Good evening, everyone. Myself, Dr. Prashant Bhokardankar, I'm a professor and head at Datta Meghe Ayurvedic Medical College, Nagpur, India. So my presentation topic is integrating Ayurveda into preventive cardiology and heart disease management. Please, next slide, madam. I would like to make some disclaimer about this, my presentation. The presentation is nothing but the collection of this internet material, hence the author doesn't claim any copyright or personal opinion. The presentation is for the upgradation of medical knowledge and used for the betterment of the human being. Next slide, please. So Ayurveda in preventive cardiology, the Ayurveda is really contributing for the cardiology segment at larger extent. So today we will elaborate that. Next one, Ayurveda, the ancient Indian system of medicine, offers holistic approach to the heart health through the balance of the three doshas, Vata, Pitta, Kapha. Next slide, please. In preventive cardiology, Ayurveda focuses on maintaining cardiovascular wellness through the personalized diet, lifestyle modification, and time-tested herbal formulation. Keep this slide, please. The integration of Ayurvedic principle into modern cardiology represents paradigm shift towards the preventive and personalized medicine, addressing not just the symptoms but the root causes of the CVS. Next slide, please. Next slide, please. How the three doshas influence the heart by the concept of Ayurveda. Vata balances, Pitta imbalances, and Kapha imbalances. If the Vata imbalance is there, linked to the high heart rate, variability, predisposition to the sinus dysfunction, manifest as anxiety and irregular rhythm. Pitta imbalances create the associated with this systematic inflammation, intermediate heart rate variability patterns linked to hypertension and heated emotions. And third one is the Kapha imbalances, stable and periodic rhythmic patterns linked to the metabolic stagnation, contributes to the hyperlipidemia and the congestion. Next slide, please. So it is in the how the risk factors are there. That's the family history, smoking, ideal, hypertension, obesity, and metabolic syndrome. Next symptom. Sorry, next slide. So the rising global burden of the heart disease as we navigate. Next slide, please. As we navigate the 2026, the human and economic cardiovascular disease have reached a critical tipping point. 2025 reported deaths are 20.5 million deaths due to CVS. Annual patient cost is around 9.3 per K, average medical cost per annually, and projected increase is 9% projected prevalence growth by 2050. Next one. So why integrate Ayurveda with the modern cardiology? That is a rising global cardiovascular diseases burden. Despite advances in pharmacotherapy, lifestyle-related risk factors remain prevalent. The gap between guidelines and patient adherence demands new and culturally resonant strategies. Ayurveda's contribution is offer a framework for behavioral medicine. Vihara, that's a lifestyle. Ahara means diet, and mind-body practices that align with the modern prevention goals. The third one is the complementary integration principles. That is the designated to complement, not replace guidelines, and directed medical therapies, focusing on reducing reliance on polypharmacy through modifiable risk factor improvement and clinical goal. That is the final and important goal for all pathies. That is the clinical goal. Safer and patient-centered improvements in stress resilience, blood pressure, inflammatory markers, and long-term adherence. Next one. Now, since 2 days, you people are just representing this modern heart wisdom. That is not unconditional. That is really, you people are really growing like anything. The bridging traditional Ayurveda and contemporary cardiology to address the 9.3 per K annual cost of the heart disease and offering integrative prevention strategy. So we can add lifestyle intervention and cost-saving care pathways and improve the cardiac outcomes. Next one. So if we add Ayurvedic lens on cardiovascular health, so and on one side we can say that Ayurvedic constructs, and on another side we can say the modern correspondence, the Hridroga, that is umbrella term for heart disorders categorized by underlying imbalance rather than the just symptoms, and a risk phenotypes we can say that hypertension, dyslipidemia, ischemia, chronic stress conditions identified through the diagnosis. Doshas, these are all the conceptual approach in Ayurveda itself. Doshas, bioenergies, that's the Vata, Kapha. That's the Vata is the movement, Pitta is the metabolism, Kapha is the structure imbalances causes diseases. On contrary side, the modern correspondence, autonomic nervous system balances metabolic function, endothelial health, and oxidative stress levels. Third one is the foundation principles, Ahara, Vihara, and Dincharya. That is the diet, lifestyle, and daily routine, where we can go for the behavioral medicines, the nutritional quality, physical activity prescriptions, sleep hygiene, stress resilience training, and individualization. That is the therapy based on constitution. That is the Prakriti, and current imbalance. That is Vikruti. Clinical translation, we can say in modern correspondence. That is the precision medicine, tailored lifestyle prescriptions, and monitored of standard biomarkers. Next one. Now we are at the 2026 years. At the same time, the global herbal medicine market growth is like anything. The market size projections is very high now. Now it in 2030 it can go more than 340 US dollar billions. So where CAD prevalence in Ayurvedic hospitals around 75% cases can be addressed. This is a very big statement by Ayurvedic person from my side. So where we can say that key market drivers are rising disease prevalence, health awareness, and scientific validation. Scientific validation is main component as far as Ayurveda is concerned. Next slide, please. Next slide, please. So what are all the herbal medicines? If we continue the previous slide, that's the main, the previous slide, please. Previous slide, please. The first herbs is the terminal Arjuna, that increases the left ventricular ejection fraction and reduces the LDL cholesterol. Second one is the garlic, the lipid lowering and anti-hypertensive property. And third one is the turmeric, anti-inflammatory and antioxidant properties. Next one. Next one. Key Ayurvedic herbs in the cardiovascular management. The first one is the master stroke, that is the Gugula, Camphora mucul. Gugulipid is the standardized extract of the Gugul resin, is one of the best studied Ayurvedic agents for dyslipidemia. The central modifiable risk factors for ASCVD. Clinical studies demonstrate reduction of the total cholesterol by around 11.7%, LDL by 12.5%, triglyceride by 12%. Active components is the main the glucocerols as a farneside X receptor antagonist and modulating the bile acid metabolism and lipid biosynthesis. Pushkar Gugulo, that is the Pushkar Mula Gugulo, has been demonstrated anti-anginal and hypolipidemic activity in coronary heart disease. Indicated in specified, that is the Medohar lipid reducing drug. The next one is the Ashwagandha Vidania somnifera, that is the adaptogen for cardiac resilience, enhances the vascular endothelial function and reduces the endothelial dysfunction markers, demonstrate anti-inflammatory and cardioprotective effects through the modulation of nuclear factor kappa B, cytokine pathways and oxidative stress, improves the cardiovascular endurance. 12-week supplementation with the KSM Ashwagandha showed the significant improvement of aerobic capacity in clinical trials. These are all the findings of what I have got on the internet itself. Inhibits the VEGF induces angiogenesis and reduces the lipid peroxidation. And a last one is the important, that is the anti-stress adaptogen, directly counteracts the sympatho adrenal activation of the chronic psychological stress, a major cardiovascular risk factor. Next one, that is the Arjuna. The Arjuna, already we have shown there in the previous slide. The bark of terminal Arjuna is the Ayurveda's most celebrated heart medicine used for the 3000 years. Modern clinical research has extensively validated multi-mechanism cardiovascular benefits. First one is the chronic stable angina. A landmark double-blind placebo control crossover trial demonstrated that Arjuna bark extract was comparable to arsosorbide mononitrate, reducing anginal frequency and improving the exercise tolerance. But this is the pilot study. We have to go for the multi-centric trials. Congestive CCF, that is congestive heart failure. The clinical trial shows the improvement in functional capacity with the active constituents. Arjunalic acid provides antioxidant, antiplateletic, and cardioprotective effects. Hypertension, a randomized double-blind placebo control trial showed the significant reduction in blood pressure and improvement in the antioxidant status in the hypertensive geriatric patients. So the mechanism of this particular drug, if you go through the multiple research papers, it shows the anti-ischemic, antioxidant, hypolipidemic, anti-atherosclerotic, and positive inotropic effects. Here we can add the textual context also. The Charak Samhita, that is the ancient Ayurveda text dedicated Hirudya Mahakasha, in which Charaka has mentioned around 10 herbs for the cardio protection. The next slide, please. That is a Pushkarmula. That is a rare endangered plant in India itself. Unfortunately, this is the very endangered plant we have got from the Himalaya region. That's why it is called as Himalayan herb. Potent vasodilator, expectorant, and cardioprotective herb traditionally used for the chest pain and cardiac weakness. Clinical studies from the Indian Journal of Physiology and Pharmacology reported beneficial effect in the angina pectoris, reducing the frequency and severity episodes. Active constituent allantolectin has demonstrated the cardioprotective activity in experimental models. Combined with the Google, can be used for the ischemic heart diseases. And Sarpagandha is the next. And Sarpagandha is commercially prepared by all the major pharmacies in India itself, and it is sold as a capsule for the Sarpagandha, Rauwolfia serpentina. The Sarpagandha holds the distinction of the being world's first recognized pharmacological antihypertensive. Its alkaloid reserpine was isolated in 1952, become the first antihypertensive drug in the Western medicine. Directly derived from the Ayurvedic plant, reserpine depletes the catecholamine stores in the sympathetic nerve terminus and the heart and reducing peripheral vascular resistance and cardiac output. Traditional Ayurvedic use of whole root is considered safer and balanced phytochemical synergy, reducing the effects. Next one. The Triphala, that is a cardiovascular tonic. The three fruit combination, that Embolica officinalis, Terminal bellerica, and Terminal stabula. Amalki, Bibitki, and Haritki. It can reduce the serum cholesterol level and LDL oxidation. Powerful antioxidant activity, scavenges reactive oxygen species, reducing the oxidative damage to the vascular endothelium. Anti-inflammatory effects, reduces the circulating anti-inflammatory markers, and especially Amalki specially demonstrates anti-atherosclerotic action in multiple animal and the human studies. Next one. So some of the other plants also are there. That's a Lasuna, that is anti-hypertensive, antiplateletic activity, and evidence shows in the some human trials reduces the LDL and platelet aggregation. Brahmi, Bacopa anti-hypertensive, anti-stress, reduces the SBP and DBP in animal model. Clinical evidence for the cognitive and cardiovascular axis. Jatamansi, anti-arrhythmic and anti-hypertensive activity. Jatamanson shows the prolonged hypotensive and anti-arrhythmic activity. Turmeric already we discussed. Andrographis peniculata, that is anti-hypertensive and anti-plateletic activity, inhibits the PAF, induced platelet aggregation, and prevents the arterial stenosis. Ayurvedic diet for Ahara, that's cardiovascular. Ayurvedic nutritional philosophy, today, Kapha and Medas. Next slide, please. So here we can say that Terminal Arjuna, Gugula, and garlic basically act as a good heart protector drugs. Next one. If we go with some charts, we can say that Arjuna is working as a nicely garlic, turmeric, gugula, and sarpagandha in heart disease conditions. Next one. So some of the important data on human trials. Next one. So clinical evidence and research. Recent clinical trials, pilot studies provide the compelling evidence for the integration of Ayurvedic protocols in cardiology. These studies demonstrate measurable improvements in CVS markers and patient outcome, arterial stiffness studies, heart revival formulations, and terminal Arjuna meta-analysis. Next one. So these are all the published paper in the PubMed and other this index journals. Efficacy on the heart revival and Ayurvedic formulation, hypertension and related risk, exploratory single arm open label trial. So here these people have got very good result for the heart conditions. Next one. In the second paper, this is the paper from the American Heart Association Journal. The Ayurveda improves arterial stiffness and cardiometabolic risk in the coronary patients, the prospective pilot study, in which Ayurveda they mentioned that Ayurveda is the ancient East Indian holistic approach to the health, yoga, meditation, and breathing exercises, and some of the medicinal herbs and other practices. So it is giving some good data for the coronary conditions. In the next one. Next one. In the conclusion, they have mentioned that heart revival of polyherbal formulation significantly lowered the blood pressure and lipid profile in the hypertension, hypercholesteremic patients in the 8 weeks. Moreover, it is also drastically effectively minimize the fatigue, chest discomfort, and breathing trouble in hypertensive patient. Furthermore, it is harmless for the hypertensive patient. Therefore, heart revival is the safe and effective medicine for hypertension and hypercholesteremia, and may be helpful in the management CVDs. Further investigation is recommended in larger population and more variable to strengthen the present conditions. Next one. So Amal ki Rasayan is very popular drug in Ayurveda itself. In Ayurveda, we have used in multiple conditions. This Amal ki Rasayan is a traditional Indian drug, enhances the cardio, mitochondrial and contractile functions and improves the cardiac function in action. So this is also a standard paper presented by these are all the authors Vikas Kumar et al. Next one. So trials on Arjuna. Already we mentioned that drug in earlier slide. The clinical efficacy of water bark of stem bark of terminal Arjuna in patients chronic heart failure, double blind, randomized control trial, given some good result. But they mentioned some impression for this paper is that Arjuna extract doesn't improve LVF in the chronic heart failure patient. So although there was improvement in the functional capacity, so we can say that here also we can go with some findings for multiple trials, antioxidant resource and symptom related domains in the some of the patients. Next one. So here we have to go with some of the important popular drugs in Ayurveda itself. That's Sarpagandha already we mentioned. That's a Shilajit. It also reduces some triglycerides and improve HDL level, and Amalkirasan already we mentioned in the earlier slides. Next one. Some of the studies already we mentioned. Next one. So how Ayurveda can contribute not only the herbs and drugs also, but they can go with some of the strategic ahara therapy. That's a important food like pomegranate, honey, garlic, ginger to naturally nourish the heart tissues. This is the Ayurvedic concept itself, and tailor the dietary intake to specify Prakriti to maintain the long-term lipid and muscular balance. Next one. So in nutshell, we can say that ahara diet, that's a personalized nutrition based on the dosha constitution, especially garlic, turmeric, ginger-like things to avoiding the inflammatory foods, light, easily digestible meals, spices, some of the spices, herbs, vihara lifestyle, daily yoga practices, pranayama breathing, stress management is the key thing everyone knows about it, and the panchakarma, this is the master stroke of Ayurveda, and we can go with the Pirechana, Abhyanga, and some of the protocols. Next one. So Ayurveda mentioned some of the yoga practices also. Bhujangasana is the important one, Uttarasana and Tadasana. So this will help for the betterment of the heart health conditions. Next one. So why should we use Ayurvedic herbs in the CVS? That's important thing. That's a safe, natural, lesser side effects, cost effective, easily available, and lesser R&D cost. Next slide, please. Easy combinations are available. These drugs are palatable. Ayurvedic herbs can be act as a micronutrients, improve the metabolic cycle. Sometimes these drugs can be act as a both dyslipidemic and cardioprotective also. And major drug is also available. That's Arjuna. Next one. So current focus for today's topic is the for many ages Ayurveda drugs can be utilized and treated the wide range of ailments related heart segments. It is now established that these drugs have unique properties from therapeutic standpoint as a potent cardioprotective agent and can be used as cardiovascular conditions. Since Ayurvedic drug has been able to reduce the amount of modern medicine, has the potential to prevent the variety of dose-related side effects also. But we need more studies, especially multi-center trials. Next one. In nutshell, we can say that safe medications without side effect is the need of our. Ayurveda can provide better combinations in cardiovascular conditions. Further insight is needed on this topic. Collaborative research can be promoted, just like the integration of Ayurveda people and the modern medicine people can highlight good drugs for the heart conditions. Next slide, please. Thank you very much for patiently listening my wonderful talk.